All right, welcome back. It's time that we want to take a look at some of the things that have been happening across the globe, and especially to do with the coronavirus scourge or the pandemic that has now claimed the lives of more than 14,000. In Kenya, we're talking about 15 reported cases. In the UK, we're reporting about 5,683. That's according to the Worldometer. And out of those, 281 people have died. There are those that are in critical condition. There are just 20. And those that are still active cases are 5,309. For the total recovered, there is the number of 93. We are speaking to a lady in the UK. This is Tabitha Kavoi, who is a public health specialist. She is also Kenyan. And Tabitha, good morning. As we wake up to the news of the rising numbers each and every day, how can you describe the situation in the UK as you talk about the situation of coronavirus pandemic?
Oh, good morning, Sam. I'm struggling to hear you, but yeah, the numbers are rising fast, just as you've mentioned. We started off with very few numbers when we started a few weeks ago, but obviously they're doubling every day and they're going up. So obviously the situation is getting a bit serious every single day.
Right. And obviously, when you reflect on this, we're looking at the situation in Kenya and the preparations that are being made to ensure we're able to handle the cases that are reported. I'm just wondering, how is the UK handling these cases? How many hospitals are at use? How many facilities? I mean, what's the capacity of the facilities that you may describe now?
Mm-hmm. Okay. In the UK, we have what we call the National Health Service, which means health service is free at the point of use. And in terms of the capacity, we have about 4,000 to 5,000 critical care beds. And at the moment, the beds are filling up very fast. So what the government is doing, it's working with private hospitals to try and create more capacity, but also try to get retired nurses, retired doctors, and taking measures like that to try and get people back to work and to try and support the situation as much as they can.
All right, so recalling retired officers, but when you look at the capacity, I mean, how many hospitals are you talking about? And for how long do you think they can sustain the pandemic with the growing numbers?
It's difficult to tell how long they can sustain the pandemic. In terms of how many the hospitals are, I mean, it's hundreds of hospitals in the UK, because what happens is we do not have what we have in Kenya, like national, provincial, we have what we call trusts, and every region has and what we call NHS trusts with different hospitals, and they are getting full very fast. So you're treated at your nearest hospital, so you don't travel very far, so your care is near your point of use. And they are getting very, very fast. So everybody's worrying now and trying to take as many measures as they can. Mm-hmm. And just to point out, in terms of hospitals, we are trying to keep people out of hospital as much as we can, and only asking people to go to hospital who are probably elderly or who are very ill, who've got underlying conditions. So we are only taking people who need the hospital so we can free up that space for people who really need them.
Okay, for people who really need them. And so when you talk about, like in Kenya, we've been learning about the terms quarantine, isolation. So when you look at how people are being treated in the UK, how would you describe that? I mean, when you look at the infections, how many are local, how many are imported?
Well, in the beginning, when the pandemic started, and we had a few cases, we were able to trace everybody and try to determine where they got the infections from. At the moment, we are testing as much as we can, but not everybody is getting tested. And I think it's a good point to emphasize in that the capacity is building up and it's becoming impossible. So in the beginning, our cases were imported, but as time has gone on, we've seen some domestic cases. So there's obviously some transmission that's going on domestically, that's going on locally. So not every case is transmitted out of those 5,683 cases you've mentioned. Mm-hmm. And just to mention, actually, Sam, just to clarify, out of those 281 deaths are people who've been tested. So it's people who've been tested and tested positive for COVID-19. So there's a whole other population that has not been tested yet. So those numbers are people who are being tested in hospital now.
Mm-hmm. So when you say that there are those that have not been tested, is it because they have not shown the symptoms, or you just you don't have sufficient capacity to do mass testing?
it's all to do with capacity, really, because when you think about it, I mean, the tests we've done already, we've done 78,340 tests. And for us to do those tests, we've only got 5,683 cases. So it is a lot of tests, or it is a lot of work that goes into testing to be able to get those positive cases. So I think the strategy is the strategy that we're using really is to do with the capacity we've got. So we're trying to limit the capacity, try and use what we have. So at the moment, the testing capacity is 5,000 a day. And the goal for the government is to ramp that up to 25,000 a day. So there's a lot of work going on testing kits and working with commercial companies and technical companies to produce more testing kits and improve that capacity.
Right. And Tabitha, there's a chart I have seen that talks about the number of cases and also referencing on the time since the first case. There's one on the left that shows a very high peak of when you don't have protective measures. Then there's another one that shows with protective measures that is in blue. I mean, how do you describe this, and where is the UK at right now?
I think how I can describe the graph is it's like any infection. It's a simple epidemic graph, and just to simplify, for every infection, the epidemic curve goes up and then goes down. And the thing is, you've got to realize if you've got any epidemic, any infection, and in this case COVID-19, and we have no measures in place, what's going to happen is many people will get very ill very quickly. Right. So the curve quickly goes up and the surge of the disease goes up. So what we're trying to do, Sam, is we're trying to flatten that curve as much as we can. I think there was a guest in your show last night who talked about the epidemic curve and flattening the curve. And what that means, Sam, is that we try to reduce the number of people getting the disease at any particular time. So you're slowing down the rate of infection. And why that is important is because the hospital capacity can only take so much. And you've got to remember that COVID-19 is an addition to existing hospital capacity. So the other diseases are still ongoing. People are still getting ill. So it's important that we consider that, and it's important that we try and spare that hospital capacity as much as possible. And the reason for that, like what you're seeing in Italy, is when people get ill very quickly at the same time, what happens is that there's then avoidable deaths because the hospitals cannot cope. So what happens is you have people who are ill with COVID-19, you have people who are ill with existing illnesses, everybody's getting ill very fast, the hospitals cannot cope, and there's many deaths. Therefore, we get very, very many deaths. So what I would urge anybody or everybody, my fellow Kenyans, is we try and flatten that curve as much as we can, slow down the infections, have fewer people, and then our hospitals can cope better.
And so, yes, we've been told here in the country that we need to stay at home. We need to keep our distance. We've been told that we have to avoid contact with people who are traveling back. I mean, what sort of measures are being taken in the UK? Do you have...
Okay, in the UK, what we've done, we've taken several measures, and the measures have come into place at different times, depending on how the curve is behaving or how the rate of infection is behaving. So the first thing we're doing is simple Public Health 101, wash your hands with soap and water, or use sanitizers if you need to, 70% alcohol. The other thing is to keep respiratory hygiene. So what that means is if you're coughing, use a tissue, bin it, wash your hands again, cover your mouth, cover your nose. Once you finish, bin that tissue, just use it once, bin it, wash your hands. The other measures that we are using is self-isolation and social distancing, and I would like to clarify what the two mean. So social distancing is where you haven't got the symptoms. You're well, you're fine, and you're keeping a distance so you do not catch the virus, or just in case you've got the virus and you're asymptomatic, you do not pass that virus to other people. Isolation is on the other side. What we mean by self-isolation is why you've got the symptoms, and then we're asking people to stay at home for 7 days. Now, if those people have family members or are living with people in the same house, we are asking those family members to quarantine for 14 days to observe if they get those symptoms, because it's a new virus, so it's not quite clear if, you know, some people could be spreading it when they are asymptomatic. So those are the main measures we are taking in the UK. The newest measure we've taken in the UK is something we are calling shielding. And the reason we've taken that measure is because we've observed that this virus is affecting our aging population, and the UK has an aging population, so we have a very aging population, and it's not a healthy population, so they've got existing conditions. So we've observed how the virus is behaving. It's affecting the elderly, it's affecting people with existing conditions like diabetes, COPD, respiratory diseases. So we are shielding those people by asking them to stay at home for 12 weeks, which is extreme measures. So we're asking that population to stay away from people, stay home for 12 weeks, and then they're getting all the support they need. If they need shopping, if they need any help, there's numbers. The army has been called out, and we are supporting them that way.
Well, you talk about you're supporting them, and that has been part of the worry here in the country, because there are several people, a great population, a big number of a big population that is still dependent on their daily wages. I don't know what lessons we can learn from the UK. I know, and I saw that about 42 trillion shillings has been dedicated to dealing with the economy. What would be your take on what Kenya can do to contain this challenge?
So the UK government has taken some measures economically as well, because as we know, this virus is going to affect the economy. I mean, if people aren't buying, people aren't selling, if people are not going to work and earning some money, of course it's going to stagnate the economy. So what the government have done is they've put a package, a huge package actually, to go into supporting the economy in different ways. So some of that, I think it's about an estimate of about 32 billion. And some of that money is going straight into the NHS, so straight into the healthcare system. The other part of the money is going into businesses, so people who have been asked to close businesses, for example, bars, restaurants, cinemas, because of the virus, so that it's going to that. And the other is going to people who probably will lose jobs or are likely to lose an earning as a result of this disease. So maybe they are self-isolating, or maybe they are on contracts, maybe they're not on permanent jobs, and people are able to do some, there's grants that people are able to apply for and to support their businesses where they've lost the money, but individually to be able to earn some money. I think the government is estimating about 80% of the yearly earnings to those people, so that everybody is not suffering.
Okay. Tell us a little bit about the social life, I believe in London. So the social life there, because in Nairobi, what we've been told and also across the country is that all the bars will have to be closed, the social gatherings will be stopped, churches will not be operational, the mosques as well. How much of these measures have been has the UK government taken?
A lot of those. As I said, the UK government is taking measures. It's taking measures every day. In everyday briefing, we are seeing something new. And what they've advised is, as per yesterday, all the bars and restaurants are shut. So London is very busy, but when you look at London, it's not the normal London now. Life has gone down. So all the bars and restaurants are shut down. The other measures they are taking is controlling the transport system, because London obviously has the underground tube stations. That's a very busy transport system in London. So they are closing some of those to try and manage overcrowding. They are still keeping some services running. So obviously the key workers, our hospital workers, could get to where they need to go. People who work in the shops that we are depending on to buy food from the supermarket. So the basic services are ongoing, and they are keeping social life they're trying to dampen that as much as they can. And even today is Mother's Day in the UK, and I think that the Prime Minister made a statement early this morning and said, do not visit your mother, they're likely to be elderly. Skype, speak to them, video call them. So life is, everybody is at home, it's very quiet, and yeah, people are trying to come to terms to these measures. But I must say it's not easy. I mean, you're asking people to behave in a way they're not used to behaving. So it's calling for everybody to come together and try and do their best.
I can only imagine, of course, we will start to feel the impact of this measure starting today. So the UK has the National Health Service that sort of addresses most of the needs, health needs of the population. Here in Kenya, you have, yes, the NHIF, but it's the NHS and NHIF are nowhere close. So how is that system, because it's well established, how is it dealing or coping with this challenge? And looking back at home, how would you compare the two?
I think the NHS is a brilliant asset to the UK, and every citizen of the UK would appreciate that. And obviously the staff are fantastic, and people pride themselves in the NHS because it's a free service at point of need, and anybody, whatever the disease or whatever need you've got, you're able to go to the NHS and you'll be seen. But in times like this, where there is a new virus, it burdens that system. You know, however great the system is, you know, it can only take things so far. So you tend to find that although we've got a brilliant NHS, you know, it's still a struggle. You know, it's getting to a point where people are still trying to fit the service into the current NHS. So there is some measures that the government is taking, like calling on retired nurses, calling on retired doctors, trying to support our frontline staff as much as we can with PPE. They've ordered some companies to produce ventilators, to produce PPE, and try and support that as much as they can. So it is a good service. But it's the COVID-19 is no joke. You know, it's putting pressure on that, and we're trying to manage as much as we can.
I wanted you to compare that with the situation here in Kenya, and what do you think are lessons we can pick?
I think the lessons we can pick, I mean, it's a learning curve. I don't think anybody can say, you know, any country can say that they've hacked this or they know what they're doing. But the lessons we can pick is working together. I think from my observations, everybody coming together is really helping. Be it people people individually taking individual responsibility. So I've seen what the Kenyan government is putting forward, and it's commendable, the recommendations they're making. It's good to see the CS comes out and gives updates every day. You know, it's good to see that they're taking measures, and that's brilliant. Now, the other thing is to bring everybody in, you know, bring the transport system, bring public health. I mean, these are the people who know the communities really, really well. These are the people who can sensitize the communities, non-governmental organizations, charities, volunteers. And let's bring that spirit of Harambee that we are very well known for, and people need to work together to try and beat this.
Okay, and yourself, Tabitha, so how are you working? How are you keeping yourself safe and even the family?
So the other thing to mention is that the UK government is encouraging people to work from home. So obviously what I'm trying to do now is work from home as much as we can. As per Friday, the schools were shut. But the schools are open for key workers. So if you've got people going to hospitals or who need to be at the front line or who need to serve the nation in time of need, like the police, the army, you know, the schools are open for that population. But otherwise, all the schools are closed. So how I'm coping, Sam, is working from home, trying to balance as much as possible as a parent, home, you know, homeschooling, home working. But it's all good, and obviously allowing, I think the other point to point out is for employers to allow that flexibility and to support the employees. So, for example, if people really need to go in, then they could go in at different times. If people are working from home, you know, try and be flexible on times, you know, bear these children at home and try and maintain their well-being, because all of this is mentally straining.
Right. All right. Thank you so much, Tabitha Kavoi, who is a public health specialist in the UK, but also a Kenyan. I'm just wondering, which county do you come from here in Kenya?
I come from Machakos County, so I grew up in Machakos County, and I did my undergraduate public health training in Kenyatta University, and then came to Oxford to do my master's in public health.
All right. Thank you so much for the work you're doing and, of course, for speaking to us on those perspectives in as far as the UK is concerned. So that has been Tabitha, and we thank you for that. So shortly after, we'll be talking to Dr. Felix Riunga, who is a specialist in the infectious diseases unit of the Aga Khan University here in Nairobi. Dr. Felix will be joining us also on Skype. We'll be talking to him to tell us on what we need to do to protect ourselves despite the measures that have been put by the government, just to ensure that we're able to go on with the situation. So I don't know whether you have some graphics to take a look at on what those measures have been. Where do we put them so that right, so the first of all, yesterday from the statement by the government, these are the events that have been banned. We have the church gatherings, the weddings, the birthdays, the merry-go-rounds. If you had planned to have a wedding this season, then it's not going to happen as of now. Then social gatherings, as I said, all of them. Then for funerals, they will be limited to close families. Should you lose a relative, then only a close family will be allowed to participate in that funeral. And also, such events must not exceed 15 people. The international flights have been suspended effective Wednesday. That is the day after tomorrow. So if you are on your way back, then you'll be allowed. But if you are to plan your trip after Wednesday, then that's not going to happen. The returning Kenyans between yesterday and tomorrow then will be required to do what is called self-quarantine. Those who default will be charged after forced self-quarantine, or rather forced quarantine. It should not be forced self-quarantine. Then the returning Kenyans must keep off the old people, just very similar to what Kavoi was telling us about the people of the UK being asked not to visit their parents. The national government administration officials will be required to enforce those measures that have been announced by the government. The police will enforce the directives. Of course, they will be working with the National Transport and Safety Authority. The police will also enforce the matatu safety as have been directed. And finally, you've been advised to stay at home. So that's the message from the government. So now we move on to what the Cabinet Secretary for Health was talking about as we prepare to speak to Dr. Felix Riunga in as far as stoppage of the churches are concerned. If we can listen to what the Cabinet Secretary said yesterday.